I'm Dr. Van Reken from Reno Sparks MedSpa in Reno, Nevada, and we're going to talk a little bit about sclerotherapy today, which is injection into the varicose veins or other veins of the legs, usually the legs, although you can do faces, hands, and other areas, and you sort of shrink them down. So think of it as if you put poison into an irrigation system, then everything that irrigation system went to would be killed. Or if you were in Vegas and your irrigation system stopped and you were gone for a couple weeks in the summer, you might have some pine trees dead. But the other pine trees on the other systems would be fine. So what we do is we selectively go after abnormal veins that are large or funky looking that somebody doesn't like, or they're causing them pain or itching, and then we inject them. The sclerotherapy that we use is with polidocanol. It's a chemical that actually is an anesthetic, so it really doesn't hurt very much. And most people have very little pain, maybe a 1 or 2 out of 10, occasionally a 3 out of 10 with injection, as opposed to some of the older things used years ago like saline. Saline can produce scarring, and saline is very painful. It isn't much used anymore. It shouldn't be used at all. We never use it. You can get rid of pretty big veins, even 5 or 6 millimeters sometimes with sclerotherapy, but you need to make sure the patient doesn't need a larger procedure and doesn't have pressure coming from the deeper veins. So we've already done that. We've done an ultrasound on Maria already, and so we know that she doesn't have a high pressure system, but she has some veins that hurt her and are unsightly, so we're going to inject them today and shrink them down. After about 3 treatments, about a month apart, most patients are about 85% better. So Maria here has some varicose veins on her legs, and we're going to get these down. We will turn the lights down in a minute. This is sort of a backlighted procedure. It's nice to do it in a dark room. And we'll backlight it with this horseshoe-shaped light, and it'll make things stand out more so when the lights are off. Now you can see that she's got these fine veins here that light up. So what you'd like to do is take a vein like this that feeds some of these finer things, inject it, and then get some of these other things to go away. So we're using foam, polidocanol, 1 part to 4 parts air. And as we inject, you'll often see things shrinking down. So let's see what happens. Well, look at that. And you can see that that vein that was there, let's look right at that area again. Just kind of, you can see the outline of it, but the foam went in and it's kind of blurred it.
30 seconds.
And you saw how that worked? Just disappearing. And there it goes. Once again, that'll get stuff 5, 6 inches away from where we injected. And you see I massage it. I want to move that product around so it does its job. So kind of understated, but they're just going away. So if we look at Maria now, I've done the sclerotherapy on this leg. I've given her 10 cc's of polidocanol and air mixed foam. These look irritated. They look a little darker. They should look that way. You can see a needle mark where I hit her. And then she's got a couple little welts here. That's not an allergy. That's where there's a little bit of product outside the vein. That happens. These will look pretty good in a week or 2. You won't be able to see anything there. And then we got a lot of deep stuff. Some of these were hit more than once. She's going to get pretty good clearance of this. Even 1 treatment is going to make her a lot better, in my opinion. Thank you for participating, Maria.
Okay.
All right.